Are you taking a hair loss pill called Finasteride? Maybe to save your hair, feel more confident? But what if that small pill is silently affecting your mood, even pushing some men toward depression or worse? Today we uncover the hidden truth about this common hair loss drug, so you can make a fully informed decision about your health. Finasteride is more than just a hair pill. It's a powerful hormone-modifying drug. Here's how it works. Finasteride blocks an enzyme called 5-alpha reductase, which normally converts testosterone into dihydrotestosterone or DHT. DHT is the hormone responsible for shrinking hair follicles in genetically sensitive men, causing hair loss. By reducing DHT, finasteride slows hair loss and can even promote some regrowth. But DHT isn't only about hair. It also plays an important role in the brain, prostate, and other hormone pathways. Lowering DHT can have unintended consequences beyond hair, which is why some men experience sexual side effects, low libido, erectile dysfunction, or change in ejaculation, as well as more subtle hormonal effects that can influence mood and mental health. So while the pill may save hair, it also altering your body's natural hormone balance in ways most people don't realize. That's why knowing the risks, sexual, physical, and mental, is crucial before starting or continuing finasteride. Most men are aware of the sexual side effects: decreased libido, difficulty with erection, or changes in ejaculation. While uncomfortable, these effects are often reversible if the drug is stopped early. Some men may even experience breast tenderness or swelling through this, although this is a less of a common effect. But what's less talked about and potentially more serious are the mental health effects. Reports and studies are increasingly linking finasteride to depression, anxiety, and in rare cases, suicidal thoughts. Some men even report persistent symptoms that last months or years after stopping the drug, a condition sometimes called post-finasteride syndrome. The exact mechanism isn't, so clear, but it likely involved changes in neurosteroids in the brain, hormones that influence mood, anxiety, and stress responses. Essentially, by blocking DHT, finasteride may indirectly alter brain chemistry, affecting how some men feel emotionally. This is why taking finasteride isn't a decision to make lightly. Saving your hair is tempting, but your mental and sexual health are at stake too. While most people focus on finasteride's sexual side effects, there's a hidden mental health risk that often overlooked. Some men develop something called post-finasteride syndrome, a collection of persistent side effects that can last long after stopping the drug. These aren't just mild mood swings. Men report depression, anxiety, brain fog, irritability, and in rare but serious cases, suicidal thoughts. Studies suggest that younger men taking finasteride for hair loss rather than older men taking it for prostate issues seem to be at higher risk for these mood changes. Why does this happen? Finasteride disrupts hormonal balance in ways we are only beginning to understand. It doesn't just block DHT in the scalp, it can also affect the brain, which relies on certain hormones called neurosteroids to regulate mood and anxiety. So here's the fascinating but concerning part. DHT isn't just a hair hormone, it's part of a network of hormones that helps maintain brain function and emotional balance. Blocking DHT with finasteride can reduce neurosteroid like allopregnanolone, which plays a key role in regulating mood, anxiety, and stress. Low levels of these neurosteroids can make some men feel depressed, anxiety, or emotionally flat. This is why, even if your sexual side effects are mild or reversible, your mental health can still be impacted. For some, these mood changes appear while taking the drug, and for others, they linger long after discontinuations. So understanding this connection helps explain why finasteride isn't just a cosmetic drug, it has real systemic effects that go beyond hairline. Beyond the research papers, there are countless real-life stories of men whose lives changed after taking finasteride. Many report persistent depression, anxiety, or brain fog that started while on the drug. Some men recover after stopping, but for others, the symptoms linger for months or even years. These aren't just anecdotal complaints. Medical studies are starting to uncover biological mechanisms that could explain these lasting effects. For example, changes in neurosteroid and hormonal signaling may disrupt mood regulation, showing that this is a real physiological response, not all in your head. Sharing these stories is important because it helps men recognize warning signs early and seek help before things escalate. While finasteride is generally safe for older men taking it for prostate issues, younger men using it for hair loss appear to be more susceptible to mood changes. If you have a personal or family history of depression, anxiety, or other mood disorders, your risk may be higher. Even healthy individuals without prior mental health concerns have reported unexpected mood shifts. That's why it's crucial to discuss your personal history with your doctor before starting or continuing finasteride. Awareness and monitoring are key. If you are currently taking finasteride, pay close attention to your mental health. Feeling sad, anxious, hopeless, or emotionally flat? Don't ignore it. Reach out to a medical professional immediately. Early intervention is critical. There are alternative hair loss treatment like topical medications, laser therapy, and lifestyle-based solutions that may be safer for your mood and overall health. Remember, your mental and emotional well-being is more important than a hairline. Monitoring yourself, being informed, and talking to your doctor can protect your health and your life. Let's be honest, your hair might seem important, but your brain, mood, and overall health are far more valuable. If you are taking finasteride and notice changes in your mood, anxiety, or energy, don't ignore it. Speak up, reach out to a healthcare professional, and prioritize your mental well-being. And if someone you care about is taking finasteride, share this video with them. Awareness can save someone from months or years of unnecessary suffering. But this is just the tip of the iceberg. Many subtle factors, hormones, stress, diet, can silently affect your mood and mental health. To understand more about this connection, check out our next video, Burnout, the overlap you don't see coming. Remember, your body and your mind deserve attention, not just your hairline. Take care of yourself because feeling good is worth more than any hair on your head. Thank you.